All right, we're ready to go. Good morning, everyone. It's wonderful to see those of you in person who are here with us at the House of Sweden, and thank you to those of you who are joining us virtually. For those of you who are participating virtually, our event today has live interpretation in French, Spanish, and Portuguese. To access the interpretation, please click on the interpretation button on the lower right section of your Zoom screen and select the appropriate language. I'm Sarah Sippel. I'm Chief Global Advocacy Officer co-lead at FOS Feminista, an international alliance for sexual and reproductive health, rights, and justice. 5 years ago, Sweden joined with the Netherlands, Denmark, and Belgium to launch She Decides, an urgent response to President Trump's reinstatement and expansion of the Global Gag Rule. And in 2018, Ambassador Olofsdotter hosted many of us from US civil society in her residence to mark the 2-year anniversary of She Decides and give us a morale boost in really difficult times. Since then, the Global Gag Rule has been rescinded from President Biden, and She Decides has grown into a global force to advance the human rights of women and girls. It is because of Sweden's steadfast leadership and support for sexual and reproductive health and rights, even when faced with the Global Gag Rule, that we are honored to have the House of Sweden host us today and to have Deputy Chief of Mission Ingrid Ask to be with us to deliver remarks. Ms. Ingrid Ask assumed her position as Minister Counselor and Deputy Chief of Mission at the Embassy of Sweden in Washington, D.C. in September 2019. Prior to her current position, Ms. Ask served as political advisor to the Supreme Commander of the Swedish Armed Forces. She started her diplomatic career in 1999 and has held positions at the Foreign Minister's Office, the Africa Department, and as head of Consular Affairs at the Department for Consular Affairs and Civil Law. Deputy Ambassador Ask, thank you for hosting us today and for being a true champion for sexual and reproductive health and rights for all.
Thank you so much, Sarah, and to all of you being here in the room and also online. It's wonderful to host you here in House of Sweden on such a beautiful day in Washington, D.C. And a special thanks, of course, to FOS Feminista for the important work that you're doing on SRHR in general and today on the Global Gag Rule that we're going to talk about. Warm thanks from me and from the embassy and from all of us. Dear friends, you're here for a discussion on what I believe is one of the most important issues to achieve, gender equality, namely sexual and reproductive health and rights. But first, especially for those in the room, a little bit harder for you online, I want to say a few words about the art on the walls around you and on the floor above you. We are in a kind of a special place here. The art around you is part of an exhibition that we have here in House of Sweden called The Arctic Highway. It's an exhibition by 12 indigenous artists from the Arctic region, illustrating how culture and art has traveled effortlessly with the movement of the wind, the sun, and the reindeer herds, creating a network of conceptual Arctic highways. And above you, I think you saw it when you came in on the floor, entrance floor, we have the exhibition Her Rights, Money, Power, Autonomy, which explores the ways in which women's economic equality and autonomy are connected to and a prerequisite for all other aspects of gender equality. So the exhibition provides a historic context to our unequal labor market. It showcases women's contributions to innovation, art, and technology, and it provides a number of policy recommendations, including on SRHR, that could help achieve gender equality to everyone's gain. So I hope also you that join us online have a chance to come to House of Sweden and to see this exhibition, which is open for public in the weekends. And I understand you will have a guided tour of this wonderful exhibition a little later. So, SRHR. It's a bulky acronym full of seemingly complicated concepts and hard to pronounce if you're out of practice. But in reality, it's very simple. All individuals must be able to decide freely if or when to have sex, to have children, and to marry. A few years ago, the Guttmacher Lancet Commission, supported by Sweden, stated a vision where, quote, universal access to sexual reproductive health and rights is affordable, attainable, and essential to the achievement of health, equitable development, and human rights for all, unquote. It still holds true. The Swedish government believes that the full enjoyment of human rights includes the rights of all individuals to decide over their own bodies, sexuality, and reproduction. We base this vision on our own national history and experience. A few words about that. In 1938, the Swedish Parliament lifted the ban on information about contraceptives. Today, access to modern methods of contraceptives is strongly subsidized by the government. In 1970, 52 years ago, the first Swedish youth clinic opened. Today, comprehensive sexuality education is compulsory in all Swedish schools. Over 40 years ago, Swedish women gained the right to decide on abortion until the 18th week of pregnancy. As of today, no woman or girl in Sweden in the last 30 years has died from having an abortion. Very important. Our experience in Sweden is that when we provide easy access to contraception and abandon laws that restrict sexual health and reproductive rights, then we considerably reduce unintended pregnancy and maternal deaths. We also empower women as societal and economic actors. An example of the power of SRHR is that Sweden today has the highest female labor participation ever recorded in the European Union, at about 80%. This is a key contribution to Sweden's strong economic growth and social welfare. Sweden is also at the forefront of the global fight for sexual reproductive health and rights, and this is a key priority of Sweden's feminist foreign policy, launched in 2014. Swedish support to sexual reproductive health and rights makes up around 60% of our Swedish development assistance for health and around 6% of our total foreign aid. We fund research, provide health sector support, multilateral contributions through United Nations agencies, and support international and local CSOs. In this regard, and on the topic of today's discussions, I would like to share Sweden's experience of the periodical activation of the Mexico City policy, also known as the Global Gag Rule. The Swedish government believes that the Mexico City policy, especially in its latest expanded incarnation, firstly, it seriously undermines the right of women and girls around the world to decide about their own bodies. Secondly, it weakens the US leading role as global health investor. Thirdly, it negatively affects our Swedish health investments in partner countries. And fourthly, it increases the number of unsafe abortions around the world. So we warmly welcomed President Biden's decision to rescind the Mexico City policy, his first week in office. But as shown by the report by FOS Feminista and as experienced by our SIDA development colleagues in the field, the harm of the global gag rule does not immediately end with its rescindment. Instead, many global health partners are unaware, confused or worried about what the rescindment means and what will happen to them the next time there is a political shift in Washington, D.C., thousands of miles away. So for Sweden, the Global Gag Rule is a nuisance that forces us to rethink our plans, finances, and partners in development aid on a regular basis. But this is nothing compared to the harm inflicted on individuals in need of comprehensive health services in developing countries, people that both Sweden and the United States are looking to support. So that is why we hope our American friends and partners will decide to permanently repeal the Global Gag Rule. Because at the end of the day, sexual reproductive health and rights is very, very simple. She must decide. Thank you very much.
Thank you so much for that kind introduction, Ambassador, and for your dedication to a strong relationship between Sweden and the United States. It is such an honor to be speaking before you all today, and I thank each and every one of you at FOS Feminista for using your precious time and energy to fight for global health equity. As the single largest funder of global health, our policy decisions here in the United States have an outsized impact on other nations. The Global Gag Rule is no exception. Over the 2+ decades that I've been in Congress, I have seen firsthand how severely it deprives vulnerable populations of critical reproductive care. Thanks to President Biden's immediate action in January 2021, the gag rule is not in effect as we speak. But not too long ago, we had a dangerous anti-abortion administration in power. Trump not only reinstated the gag rule, but radically expanded it, threatening global health and undermining local efforts to save lives and expand reproductive rights. It shouldn't matter where you live or how much you make. All people deserve access to safe and affordable reproductive care, including abortions. Doctors should be able to talk freely with their patients about their options and not just what anti-choice politicians here in the United States consider acceptable. Every time we change administrations, the global gag rule leaves behind a chilling effect. We can no longer undermine the sustainability of global health programs and our pace of progress. Congress must make this repeal permanent before any future presidents can jeopardize our progress again. As co-chair of the Pro-Choice Caucus and chair of the Appropriations Subcommittee on State and Foreign Operations, I'll keep working to end this dangerous and cruel policy. I'm vowing today, once again, to continue to fight hard with my colleagues to pass my bill, the Global HER Act, which would permanently repeal the global gag rule and protect the health of millions. And I urge you to join in this fight with me. Thank you so much for your support.
Hi, I'm Congresswoman Jan Schakowsky, and I want to thank FOS Feminista for inviting me to the launch of this very important report that you are making. You know, we know that the global gag rule is a deadly policy, and it's been around off and on for almost 40 years. And what it says is that foreign assistance from the United States of America cannot go to any NGO organization around the world that performs abortion, even if they do it with their own money. They're not looking to spend any federal dollars, US dollars, but spend it with their own money. But if they do it at the same clinic, no way can they get any money. And unfortunately, it's also partner with what we call the Helms Amendment. When Jesse Helms, Senator, put through the Helms Amendment shortly after the ratification of Roe v. Wade by the United States Senate, that countries, not just NGOs, but countries and NGOs no longer could perform abortions unless it was under very, very limited circumstances, and even those are violated most of the time, as a ban on abortion. So what we need to do, my brothers and sisters, is to repeal both the Global Gag Rule and the Helms Amendment permanently. So that isn't this back and forth, there isn't this confusion, there isn't this uncertainty of not-for-profit NGOs around the world or countries on whether or not abortion can be funded through federal dollars. So I am the sponsor of the Global HER Act, and that would do just what I was saying, repeal permanently both the Global Gag Rule and the Helms Amendment, and think of all the lives that would be saved. You know, those pieces of legislation or those rules that we've had are, as I said at the beginning, deadly. So let's stop that. And I hope that you'll join in that fight to permanently repeal both of those, the Global Gag Rule and the Helms Amendment. And I know that you're fighters. And when we fight, we win. Cuando luchamos, ganamos.
Well, thank you, Congresswoman Lee and Congresswoman Schakowsky, for your tireless efforts fighting to end the Global Gag Rule and advance sexual reproductive health and rights for women and girls in the U.S. and globally around the world. And thank you again, Deputy Ambassador Ask, for being a leader and for really supporting the advancement of sexual reproductive health and rights and ending this horrible policy, which, as you noted, the Swedish government and other donor governments really are experiencing firsthand how it undermines global investments in public health. So good morning again and welcome. Together we are gathered here in person at the House of Sweden and also virtually. We're around the world with a very diverse group of people who are advocates. They're in government, donors, media, researchers. The geographic and sector diversity of those of us gathered today really shows the depth and breadth of how harmful the Global Gag Rule is, and also of this growing movement of people around the world to end the Global Gag Rule. And we're thankful for the support of members of Congress like Congresswoman Lee and Schakowsky leading the effort to eliminate this policy. So once again, I'm Sarah Sippel. I'm Chief Global Advocacy Officer co-lead at FOS Feminista. FOS Feminista is a new global feminist alliance created last year with the 3 organizations coming together: Change, the Center for Health and Gender Equity, International Women's Health Coalition, and IPPF-WHR. And we came together with a vision to advance sexual and reproductive health rights and justice through an intersectional feminist lens and a commitment to the leadership from the Global South. The Global Gag Rule research is one of the threads that demonstrates the power of the FOS Feminista Alliance. IWHC partnered with TICA in Kenya, AVA in Nigeria, CSSR at Rhodes University in South Africa, and CREPA in Nepal to document the devastating impact of the policy throughout the past administration. And I'm so glad that today many of the researchers are joining us virtually today, and that Dr. Puri from CREPA is in the room with us, and you'll hear from him soon. Change worked with partners to research the impact of the policy in Malawi, Mozambique, and Zimbabwe. And IPPF-WHR worked with their partners to document the impact in Barbados, Belize, Colombia, Dominican Republic, El Salvador, Guatemala, and Honduras. And today, as FOS Feminista, we are launching our new report that builds on all these years of critical research. Chaos continues: the 2021 revocation of the Global Gag Rule and the need for permanent repeal. This report relies on first-of-its-kind research that documents the impact of the U.S. government's communications and actions following President Biden's revocation of the policy in January 2021. While past research has focused on the devastating impact of the policy when it's in place, its impact on healthcare delivery, on advocacy, and national sovereignty, this report investigates what happens to those efforts and services when it is revoked. So for those of you who are learning about the policy for the first time, I want to take a step back and say what we're talking about in terms of the Global Gag Rule. It's officially known as the Mexico City Policy, and under the Trump administration, Protecting Life and Global Health Assistance. It's a policy that prohibits foreign, non-governmental organizations that receive U.S. global health assistance from using their own non-U.S. funds to provide abortion services, counseling, or referrals, or to advocate for the liberalization of abortion laws as a method of family planning in their countries. President Biden's memorandum on protecting women's health at home and abroad revoked the Global Gag Rule. It also marked the first time a U.S. president recognized the phrase sexual and reproductive health and rights. President Biden stated, "It is the policy of my administration to support women's and girls' sexual and reproductive health and rights in the United States and globally." President Biden's statement signifies the furthest any U.S. administration has gone in its recognition of sexual and reproductive health and rights. But as an advocate, I have to say it's not enough. We welcome it, but more needs to be done. Because to make the promise of sexual and reproductive health and rights a reality, it will take more than a stroke of a pen. It will require additional time, funding, and international efforts to realize the full potential of this policy change and support the health and well-being of women and girls and gender-diverse people around the world. Today's conversation will address what has happened since the revocation of the Global Gag Rule and the steps the Biden administration can take to actualize the removal of this policy. And before I turn it over to the speakers for today, there are people I need to thank and recognize. First and foremost, Giselle Carino, Fos Feminista's CEO, and her steadfast support for this research over the years and for today's launch. And I'm sorry she was not able to join us here in person. I also want to recognize Kemi Akinfederan, who is my co-lead in the Global Advocacy Unit, and she is actually today in Nairobi at a meeting with other African feminist leaders talking about how to advance sexual reproductive health and rights, and on their agenda is this conversation about what more can and should be done since the revocation of the Global Gag Rule, since Biden revoked it. A special thank you to Bergen Cooper and Sammy Luffy of Fos Feminista. They led and conducted the research and analysis. I also want to thank the Emory University faculty, advisors, and student researchers who contributed to the research reflected in the report. And finally, I want to thank the people who participated in 57 in-depth interviews. Your contributions, both on the record, off the record as anonymous, illustrate what is happening and helps build a roadmap for what we need to do next to make the repeal of the Global Gag Rule real. I'm so grateful to our panelists joining us in person and virtually, and it is my delight to hand it over to Bergen Cooper, who will take the lead in moderating our wonderful panel conversation. So thank you again for joining us.
Thank you, Sarah, for joining us up on the stage here. Oh, thank you, Deputy Ambassador Ask. You make me want to move to Sweden, like now. I am excited to be with you all today here in person, on Zoom, on YouTube. We're doing all the technology. My name is Bergen Cooper. I'm the Director of Policy Research with Fos Feminista. I am thrilled to be here. I am thrilled to have worked with Sammy Luffy, with Sky Bear at Fos Feminista, and a brilliant team of researchers from Emory University to bring this data alive today. So, let's get started with a bit of housekeeping first. For our friends on Zoom, there is live interpretation. I understand there was a hiccup, but hopefully, thumbs up. You are getting good live interpretation now. In terms of questions for our panelists, please use the chat box to ask questions throughout the event. And if you have any questions for a specific panelist, please just name that in the chat box and we'll be able to see it. And also, please use the chat box to introduce yourselves. Where are you from? What's your name? What's your organization? What are you excited to hear today? Us in the room, we get to chat with each other. I hope you in Zoom get to chat with each other as well. So we have a fantastic panel today who I will introduce in a moment, but I need to take the moderator's prerogative here and tell you a little bit more about the research that we're launching. There's a global cohort of researchers, oh, I see some of you in the room, who are documenting the impact of this policy around the world, and we have been getting an incredible amount of data around what happens when the policy is in place. But we don't know enough about what happens when the policy is revoked. So we set out to fill that gap. We conducted 57 in-depth interviews with US government staff, with international NGOs, and with civil society based in Malawi, Mozambique, and Zimbabwe between July and October of 2021. We found that even after the Global Gag Rule is revoked, some NGOs were unaware of the revocation and continued to comply with the policy. And some US agencies continued to attempt to implement the policy. Now we know that prior iterations of the GGR caused significant harm. What we know is that some of that harm is lasting into the time after the policy is revoked. Oh, my pages are sticking together. Here we go. So we also know that the GGR infringed on national sovereignty and disrupted political advancement. Overwhelmingly, we heard, the revocation is necessary, it is welcome. Generally, the US government employees that we spoke to believed that they had done everything necessary to communicate the revocation. However, most implementing partners that we spoke to did not believe that the US government's communication was sufficient to assist them in adapting their programming and understanding the revocation. Now, the US government is only responsible for communicating the revocation to their prime partners. Then it's the responsibility of those prime partners to communicate the revocation to their subprime partners. At times, the failure of the US government and prime partners to sufficiently communicate the revocation prolonged the implementation of the policy and unnecessarily prevented people from accessing legal abortion services. We heard from US government and civil society alike that the constant back and forth of the policy caused significant setbacks in US global health assistance. And we spoke to one US government staff who said to us, we're just trying to get back to the baseline of 4 years ago, as opposed to moving forward. We spoke to a prime partner in Zimbabwe who incorrectly applied the policy to a sub-partner in the previous administration by not allowing referrals for abortion in the cases of rape or incest. And that prime partner also did not tell their subprime partner that the policy had been revoked. We learned that USAID erroneously enforced the policy on an organization that did not receive US global health assistance. In turn, that organization flowed the policy down to their subprime, even though that subprime was through a contract. We also met with an organization who received a cooperative agreement for a new award from a US government agency in 2021, after the policy had been revoked, that still had the language in it. Implementing partners and advocates alike voiced the need for a more detailed, actionable guidance and additional monitoring to support compliance with the revocation. But overwhelmingly, we heard permanent repeal of the Global Gag Rule is the only answer to promoting SRHR across the US global health landscape. There is so much more in the report. For those of you who are in person, you have a little QR code that's going to take you right to the report. For those of you on Zoom, it's in the chat. So I look forward to all of you engaging with the data. But Now let's turn to our panel, who is both with us online and in person. I'm going to start with my dear friend, Rosé. Hi, Rosé. I would like to introduce Rosé Agtasadi, a public health specialist and human rights defender, currently serving as executive director of SOFAID's Regional. She has over 23 years of service in Africa within social justice, clinical, academia, health, and human development sectors. Her professional pursuits advance gender and SRHR justice in community, institutional, and policy spaces. Her passion centers on elevating dignity and agency of women and girls, children and youth, and populations in most dire circumstances, socioeconomically and politically. As a strategist and innovator, systems developer, and organizational development practitioner, Rosé is an enthusiast for community development and voluntarily serves on several platforms that address human and social development change. I first met Rosé in Zimbabwe over 5 years ago when we were documenting the impact of the policy. She is a fantastic advocate, and I'm very lucky that she's joining us here today. Rosé, let me ask you. During the Trump administration, your organization lost critical U.S. global health funding to implement PEPFAR's DREAMS partnership, all because of the Global Gag Rule. As a former prime partner, you have a unique perspective on communications around revocation. So I would like to ask you to discuss the communication around the revocation, as well as telling us about how the policy impacts advocacy, intersectional movements, and intersectional identities. Rosé?
Thank you, dear Bergen. Firstly, a huge congratulations to FOS Feminista on generating this very rich report. And I really look forward to its utilization both swiftly and effectively, not just in the US, but of course around the globe. So that's quite a loaded question. I will speak more briefly on how the communication reached us because it was just bland and basic. Background-wise, the MCP, when it was reenacted by the Trump administration, communication was promptly shared with us because at the time, as you rightly said, we were a prime recipient in one country and we were a sub-recipient in another country in the Southern African region of PEPFAR funds. And so as soon as it was enacted, there were speedy processes put in place at mission level, and it really left many partners, especially civil society like us, pretty dizzy with shock and confusion. And of course, anxieties of what this meant for the efforts that had already been invested in HIV, SRHR, and women and girls' rights interventions. So it was swift, to the point, and executed like the drop of a guillotine. However, when the MCP was rescinded by the Biden administration in 2021, this same fervency, as you've alluded to and the report alludes to, and I can attest to on the ground, of swift action and formal communication that the GGR has been lifted did not take place. So how did we find out? Like many others across the globe, we were, of course, tracking the US elections, and we were aware that there was a high probability that if the Biden-Harris administration won, there might be a lifting of the GGR. And this optimism then motivated us to track President Biden's actions in his first weeks of office very intently. And we did this through online spaces. At the time, Change, now FOS Feminista, had very efficient social media platforms, as did POTUS platforms and some USG state platforms. And that's really how we got the good news. And much later on, almost a month or so, 2 months, I think, or so, did it start to come out more formally in the development spaces that we were working with together with PEPFAR funders. Now, this illustrates that the GGR not only caused devastating impacts on SRHR of millions of women, adolescent girls, and their families, but it also caused a dramatic divide between development partners. And this division of the 3 to 4 years was a forced one, as partners like ourselves, who spoke out boldly on all SRHR without exception, including unrestricted access to safe abortion and contraceptives, we could no longer share similar platforms, panels, and spaces with partners who had chosen to sign on the PLGHA and were GGR compliant. And gradually over the years, we drifted apart and collaborative synergies waned. And this is testimony to lessons that are important for us to appreciate. Testimony to how political stances of damage such as this can really destruct and fragment the development agenda and force development actors to make decisions that cost rather than save lives. This was testimony to how far away we are from decolonized health and rights responses. And I speak from the Global South here. It was also testimony that policies of harm, such as the MCP, instantly crippled cooperation, which is absolutely essential to human and social development, between multi-sectoral diverse organizations who have held the same populations at the heart of their services, but are set apart due to a harmful policy decision and ironically made in another country. Now, of course, amidst this, I think it's very important to raise that the crisis of the GGR also created some default victories that we created. Partners like ourselves, SAFAIDs, and others who relinquished multi-million PEPFAR-funded programs, and we chose to take on the principled position on all SRHR, embarked on GGR counteractions, and purposefully and intently scaled up safe abortion advocacy, where prior to GGR, we may not be doing as much. Institutions we've heard earlier, such as Guttmacher Institute, also escalated, generating rich evidence on the consequences of not honoring safe abortion as a human right. And as we know, we learned better that it was not just a matter of saving lives, but also it was a matter of national security, macro health economics, and other issues that are relevant for governance. Aid agencies, and we heard this earlier from Sarah, really stepped up, and we felt the solidarity as civil society. SAFAIDs in particular felt this with CEDA Sweden and the Dutch, who stepped up, swiftly closed the glaring funding gaps, and they recognized that if these gaps were not closed, the efforts made in the previous years in securing sustainable SRHR were going to be rolled back. And then, interestingly, partners who may normally not have converged, such as SAFAIDs and Change, magnetically began to galvanize, and North and South solidarity in advocating a safe abortion response consolidated. Now, moving to the now, we have in the past year, of course, basked in the warmth of the lifted GGR, renewed cooperation with PEPFAR partners and agencies, and once again we can become one large united development force of transformation in the HIV and SRH and gender equality responses. However, we're very mindful that as each year passes, we get closer to the next US election. And as long as the MCP is not permanently removed, we creep closer to the risk of GGR being back in force with a new administration. And we have no guarantee that this will not happen, even if the administration that comes in, we perceive currently, is liberal. Thus, efforts such as those made by FOSFA Minister and others towards permanently removing the MCP is fundamental to safeguarding SRHR globally and achieving many of the targets of the SDGs. And it's critical for us to keep saying this and reminding states and policymakers that SRHR, as simple as it is, also has a significant impact on them achieving several of the SDGs. We know how intersectional a robust SRHR response needs to be. And the GGR fragmented these intersects, deepened gender inequalities, grossly threatened diversity, safety, inclusion, driving populations such as LGBTQI+, sex workers, and others left behind traditionally into more periphery and away from enjoying their rights. So, beyond loss of lives and violation of the right to health, security and democracy is also impacted when policy decisions such as the MCP and its expansion are made in such an unethical nature. Thank you, Bergen.
Thank you, Rose. Thank you so much. You know, I was drawn to what you were saying about how far we are from decolonized global health, a conversation we all have so often here in Washington, D.C. and around the world. But then thank you for inspiring us and reminding us that how during this time we were, as you said, galvanized together, and the solidarity that was created across civil society and funders is hugely important. Thank you so much, Rose. Now we are going to turn to my friend here in the room with me. Dr. Mahesh Puri is the co-director of the Center for Research and Environmental Health and Population Activities, CREPA, a national research organization based in Kathmandu, Nepal, and among few Nepalese organizations that refuse to comply with the Global Gag Rule. Dr. Puri is trained in the UK universities on SRHR-related research and actively involved in these areas of research for more than 20 years in Nepal. He has widely published work in peer-reviewed journals. He has extensive experience to engage concerned national-level stakeholders, including the Nepal government in the research process and results uptake, particularly on family planning, abortion, adolescent health, and gender-based violence. After the enactment of the Global Gag Rule by the US government in 2017, Dr. Puri is assessing the impacts of the policy on health sectors in Nepal. You know, Dr. Puri, I'm so glad you highlight in your bio that it's not just the research, but actually talking to the government and engaging in change. I'm so honored to be able to collaborate with you and to see you here in person. So, CREPA has conducted research in Nepal on the GGR, both while it was in place and since it's been revoked. Can you tell us a little bit about the findings, both from the impact of the policy and also a bit of what you know about what happened after revocation?
Okay, thank you so much, Bergen. It's my great pleasure to be here in person and sharing, a little bit kind of history about, kind of legal changes in Nepal in the last 2 decades. And also kind of, the major findings we have, found about impact of GGR before the revocation and after the revocations. While sitting here and listening, the deputy ambassador from Sweden, it reminds me my old days, actually 20 years ago, when I went to Ministry of Health, and then I was like hoping to make one poster which was about avoid using unskilled persons for unsafe abortions. So we wanted to give just that message. It was strictly illegal at that time. It was 1998. And then the director at the Ministry of Health, I still remember, he said, no, we cannot use the word unintended pregnancy and abortion. So you cannot have these posters in Nepal. So it was just 20 years ago. And then we used other strategy. We managed to publish that posters, and it was actually used for public education and advocacy to avoid unsafe abortion in the country. In 2000, actually, we conducted a landmark study in Nepal. Probably you have heard about that. It was a nationwide study about women in prison in Nepal. So we conducted nationwide study, and we found 17% of women at that time in prison was because of abortion. It was 20 years ago. Now it's my great pleasure to share with you that now Nepal has one of the very progressive laws in terms of sexual and reproductive health and rights. In 2002, we managed to liberalize abortions. In 2015, we have a new constitution which actually guaranteed reproductive rights, including abortion. And 2018, we have a new act that even now re-stress that reproductive health is a basic fundamental rights in the country. So you can see the policy shift in just 20 years. And also in terms of services, I think Nepal has made a very good progress. If you look at like antenatal care, very good, like more than 85% women have at least 4 ANC checkups. Very good on postnatal care. We have about 60% delivery at the facility. Family planning, doing very good, all free in public facility. In 2016, even abortion service now free in public facility. You know, so these are like, and then abortion service is like providing by even auxiliary nurse, midwife, nurses, you know, medical doctors. So even sometimes I think back, and then 20 years ago, wow, nobody was talking about abortion. Now, at least we have that kind of atmosphere. And then the country has achieved so much. Having these kind of improvement in policy and some of the program, but we have a lot of challenges as well. These recent advancement in the country is not even, it's not, same across the regions, across the social group, across income quintile. We have a problem of accessibility. And then, of course, the quality of care issue is still there. So Nepal also, achieved like a drastically reduced maternal mortality from like a 439 per 1,000 live births in 1996 to now we have 239 per 100,000 live births. So these achievements made, but still we have one of the highest maternal mortality rate in South Asia. So the country is committed for SRSR services. Probably you have heard that Nepal has gone to like a unilateral system to federal structures in 2015, and we have new constitutions. And that demands for additional resources as well to actually implement and practice that federal structure. And there is some kind of confusion between the, the central level government and local level government about the rights, who provides what kind of services, who is responsible for what kind of health facility. That kind of confusion is still there. And in these situations, Nepal needs a kind of additional funding and resources to really, keep these kind of recent advancements in terms of policy and the programs. On this context, what happened is suddenly we have this Global Gag Rule in 2017. That USAID over we have a long history of supporting Nepal, like over 75 years, we have a diplomatic relationship, and USAID is supporting Nepal both financially and technically in health and sanitations and a lot of other infrastructures area as well. But after the implementations of GGR in 2017, a significant amount of funding loss was there in the country. So because of that, there was a kind of seriously that undermines Nepal's ability to sustain kind of achievements Nepal has made recently, and also is going to give more challenge to actually achieve the goals and achievement goals and target, including SDG. So that was the kind of challenge that Nepal is facing during the GGR implementation era. We, as Bergen said, we conducted a research between 2018 to 2021, 3 years, during the, the implementation of GGR, and then 1 year after the, revoking the policies. There are key kind of the impacts we have in Nepal. The first one, the first impact of GGR is it's really threatening the improvements of women's health, and it contradicts. We have a lot of confusion there as well, and it's because it contradicts with national law and act, what to do. It's not only it's a question about the money and support. It's also contradicting with the national law. What to do in that case? So that and that's really threatening the whatever achievements. Because I started from the history. Whatever achievements we have made in the last 2 decades is like threatening that kind of achievements because of the GGR. And second is like really it's created a funding gap in the country. Immediately after the implementation of a GGR, 2 major agencies who actually implement family planning program in the country, they were covering 25 districts out of 75 in the country. They were really working in the hard-to-reach populations, difficult area. And then once the GGR is implemented, actually they terminated that contract before the scheduled time. That really has an impact of providing family planning services in remote area. And then the impact is basically they were working in a remote and underserved area on unreached populations. So because of that, really is impacted the population who live in remote mountain area and then socially marginalized, excluded community. They were the kind of more victim, penalized because of this policy. And then also because of that, a lot of quality of care on SRSR is compromised. What happened is in Nepal, I would say that there is a very good kind of combinations and harmonized kind of program between civil society, international NGOs and the Ministry of Health. And then we sit together there as a group, we sit together, we actually plan together with the Ministry of Health, especially in the health sector, we have a very good relationship. And then the government actually give certain areas for INGO to work with, NGOs to work with in family planning SRSR area. What happened is, like, because government doesn't have that much of resources or technical competency to provide even the training to all the service providers of family planning or SRSR services, so they join hand with civil society organizations and INGOs. What happened, because of the funding restrictions, what happened is NGO could not provide services to the health providers. Even not only the training to the service providers is also kind of commodity supply, family planning supplies, was affected at that time, So that all actually affected the quality of care, especially in the remote area. We assessed in 2021, we actually monitor the maternal death reported in the media. And then there was like a 1-year period only reported in media, like about 34 maternal deaths were reported in media 1 year time, and 2 were two deaths was because of unsafe abortion. And we traced back why that death happened, that unsafe abortion, and we actually found that that death occurred in the area where either, because of the funding loss, either they have to scale down the program or actually have to stop providing safe abortion services. So you see, it's not a kind of casual or causal effect, but we see some kind of, the signals, there are indications of that once you, stop providing the services, regular services, that who is going to affect is basically going to impact on maternal death. That's what happens in those 2 districts. We could easily avoid that if the safe abortion services was continued at that area. The other impact is, I would say, a kind of triple burden for a country like Nepal. One is as you know, Nepal, we don't have, very resilient health system. We have a fragile system, health systems, because of being a poor country, our health system is very weak. On top of that, as I said, we moved to federal systems, and then that needs more resources for implementations. And then we have this COVID, and then all the government resources actually diverted to preparedness and response to COVID. And then on top of that, we have GGR. So you can imagine, the government, their effort is going for COVID, the response, and then other civil society and NGOs and INGOs supposed to work in this kind of basic health, and then because of this funding cut, they couldn't provide the services. What happened is, fortunately, what happened is immediately after the COVID, all the, like about more than 35 health facilities stopped providing maternal health services, basic maternal health services, including abortions in the country. And then all the civil society organizations, NGOs, came together with the Ministry of Health and rapidly prepared an interim guideline, to provide that kind of service, to continue that kind of service during the COVID as well. But what happened is, like government, yes, the interim guideline was endorsed by the government, but they don't have resources to actually implement that interim guideline to resume the services. And then, on the other hand, INGOs has that problem because they don't have that capacity or resources to actually implement that interim guideline. And then other, the impact is really GGR, break down the coalitions and partnerships we used to have in the country that really, impacted on the duplications of effort, because now suddenly USAID used to contribute in the meeting and everything, and suddenly they stopped attending any kind of meeting. I don't know whether that is a kind of official policy or not. They just stopped even attending a research dissemination meeting. I was surprised, actually. So the last one is like GGR also actually silence of voices of the community and then also the media. There is a kind of fear among the people, even among the media personals, to talk about GGR. They think that, oh, this is the US policy. If you talk about this policy, then you are against the US, which is not true. Nobody from USAID government actually I don't remember any kind of meeting they have been attending and saying what GGR is, what is allowed and what is not allowed, And then the people are fear, even talk about that, the policy. So these are the kind of major findings of the impact during the GGR implementation. Just 1 or 2 points after the revocations, we conducted a rapid study, and then we found that this is largely welcomed. Everybody welcomed this one, and then there is a ray of hope that now we can rebuild our coalitions, and then we can work together, and then those who lost the funding during the GGR implementations, they will be able to apply again for a US grant and then work together in the country. So that hope is there, but still I cannot say how this is going to be implemented in the ground. Because I see a lot of communications gap, as Birkin said in the beginning, probably US government, that communication went to the USAID, maybe the primes only, but the implementer actually is not the prime. It's the implementer, it's the ground level NGOs who is implementing the program. And I have a suspect, I have a doubt that actually they know, the revocations, and then what they can do and what they cannot do. So I see the kind of gap in communications within these systems as well. So I will stop here. Thanks.
Thank you so much, Dr. Puri. And I'm glad you came back to hope, because when you started speaking and you were talking about the advancements over 20 years, I mean, that's an incredible amount of change in a seemingly short period of time. But then how a foreign government can come in and impact national sovereignty like that is deeply disturbing and a hit to this effort to decolonize global health that Rosé had mentioned earlier. Well, thank you, my friends. So for our next speaker, Helena, I'm going to jump over to you, if you don't mind, as we deal with some technical difficulties on our back end here. Helena Chiquele is a feminist and women's rights activist with over 15 years of experience in managing gender justice programming on women, economic empowerment, political participation, and sexual and reproductive health and rights, with a focus on social norms. She is currently the Oxfam Southern Africa Gender Justice Program and Policy Manager based in Mozambique and regional focal point for prevention of sexual abuse and exploitation. Helena, it is so good to see you. I remember sitting in your office 5 years ago in Mozambique, hearing all about the impact of the GGR. It was so wonderful having you in Washington, D.C. to talk about that research, and I look forward to the next time we get to be in the same room. But for now, let me ask you a question over Zoom. We know that the GGR infringes on national sovereignty. We're just talking about it. Can you tell us a bit about the impact of the policy on democracy and any progress that has happened since the policy has been revoked?
Thank you so much, Burden. Such a pleasure being here, a privilege, in fact. I will speak in Portuguese this time around. I know we have interpretation. And you know, I always get so excited, and so this issue is very close to my heart. So I'll speak in Portuguese if you allow me.
Yes, please.
Muito obrigada pela sua questão. Vou falar devagar para permitir a tradução como deve ser. O bom de falar depois de duas pessoas terem falado é que a maior parte das coisas já foram ditas. Há muitas similaridades entre o que aconteceu nos vários países que sofreram o impacto da política da Cidade do México. Em Moçambique, nós notamos um grande impacto, não só nas áreas de direitos de saúde sexual e reprodutiva, mas noutras áreas de saúde também. É importante lembrar que os Estados Unidos são o nosso maior doador bilateral para a área da saúde, para a área da HIV-Sida, com um particular foco. Portanto, estamos a falar de um grande alcance deste impacto para o país. O que nós notamos, além do que já foi dito pela Rousseff e pelo doutor, foi que a agenda dos direitos das mulheres, justiça de gênero, em Moçambique foi muito afetada com a política da Cidade do México. A política da Cidade do México criou uma onda de medo. As organizações da sociedade civil sentiram um maior controle sobre as suas intervenções, maior ênfase das organizações das mulheres, dos direitos das mulheres e das organizações feministas. Você me pergunta qual é o impacto na democracia? Foi grande, porque o espaço de intervenção dessas organizações ficou afetado no momento em que havia um controle sobre a sua liberdade de expressão, o que elas podiam ou não podiam dizer. Foi um grande impacto na democracia também, mais na soberania do país, porque a questão do aborto seguro é uma prioridade que foi definida pelo governo, em coordenação com as organizações da sociedade civil, sim, mas é uma prioridade do governo. Então, quando nós temos um doador, um país externo, que chega ao nosso país para ajudar com certos pedidos, com algumas, foge uma palavra agora mesmo em português, condicionalismos. Para que essa ajuda seja aceita, e não considerando as prioridades definidas pelo país, significa que não reconhece a soberania desse país. O governo, nas suas intervenções, não era diretamente afetado, mas era afetado indiretamente aqui. As prioridades definidas pelo país são depois aprovadas pelo próprio governo. Então, nós tínhamos fundos que vinham com condicionalismos que nos obrigavam a vender a alma para que possamos utilizar estes fundos. A Rousseff falou de divisão entre as organizações. Nós estávamos a implementar um projeto, a Oxfam estava a implementar um projeto que era financiado pelo governo sueco, que tem agenda feminista. E tínhamos parceiros que recebiam dinheiro do governo sueco através desse projeto e recebiam dinheiro do governo americano. Estas organizações tiveram que tomar decisões difíceis que tiveram depois impacto nas beneficiárias últimas. Criou um ambiente de desconfiança que no final do dia resultou que as beneficiárias tivessem um apoio reduzido no que diz respeito aos seus direitos, saúde sexual e reprodutiva, principalmente ao nível das comunidades, onde as organizações da sociedade civil trabalham lado a lado para complementar a ação do governo, que não é suficiente. Então, tivemos também a população de risco, como a comunidade LGBT, que também viu-se afetada, porque muitas organizações trabalham com direitos das mulheres, mas também trabalham com os direitos das comunidades LGBT. Então, as organizações que tiveram coragem de não aceitar o dinheiro americano por causa dos condicionalismos, tiveram que parar de dar apoio a essa população em risco. O que eu posso dizer é que os efeitos da política da cidade do México ainda vão se sentir, ainda não sentimos todos. Neste momento, nós temos a agenda do aborto seguro afetada pela política da cidade do México e, como foi referido pelo panelista de Nepal, com a Covid, nós agora temos uma situação em que os poucos recursos que iriam para direitos de saúde sexual e reprodutivos estão a ser canalizados para responder à questão da Covid. Então, além dos efeitos da política da cidade do México, nós temos que gerir os efeitos do desvio dos fundos para responder à questão da Covid-19. Então, para responder a sua pergunta diretamente, o impacto da cidade do México ainda vai se sentir por muitos e muitos anos. Então, é a nossa agenda, é a nossa prioridade que esta política morra completamente. Não podemos ter mais um retrocesso como este. O aborto inseguro é a causa para 9% de todas as mortes maternas. O aborto inseguro é uma questão de saúde pública. Se nós continuarmos neste vem e vai da política da cidade do México, nunca vamos conseguir resolver este problema e mais mulheres vão morrer, e mais jovens vão morrer. Não existe ninguém que não foi tocado pela questão do aborto inseguro. Vidas de mulheres e jovens estão a ser por causa do aborto inseguro. Então, é uma prioridade do país, é uma prioridade das organizações da sociedade civil, é uma prioridade da Oxfam que a política da cidade do México seja definitivamente eliminada. Agora, me perguntava se nós já vimos algum efeito da revogação da política. Não, ainda não vimos. Fizemos um relatório há pouco tempo, só de uma província, e verificamos que ainda temos problemas sérios de disseminação de informação sobre aborto inseguro. Porque, para vocês perceberem, nós tínhamos problemas internos para criar um consenso à volta do aborto inseguro. Era um consenso muito vulnerável, muito precário. E quando chegou a política da Cidade do México, ela deu uma desculpa, um pretexto para aquela resistência voltar a surgir. Então, ainda não conseguimos ver os resultados. Estamos felizes que foi revogado, mas ainda está muito cedo para nós verificar o que realmente já estamos a viver em termos de voltar para os ganhos perdidos com a política da Cidade do México. Obrigada.
Thank you so much, Helena. You know, I agree with what you're saying about how it will impact national sovereignty and the way you talked about the distrust that the policy creates among civil society. We see that through the chilling effect. We see that in so many different ways. And yes, I mean, we absolutely see from the data that we will see the effects for years. But honestly, I can't agree with you enough that the GGR does need to finally die. It's brutal language for brutal policy. Thank you so much, my friend. And I do apologize for my friends in the room who did not hear translation. Everyone on Zoom did, and I'll let you in on a little secret. Those of us in the room get a little snacks and reception afterwards. So it all works out for everyone. My friend, Emma, I am so happy to see you here on screen. Emma Kalia is a human rights, gender, and women's rights activist and currently serves as the director of the Malawi Human Rights Resource Center. Over the past 30 years, she has worked across several portfolios and organizations. She is a board member and advisor to many institutions and is the chairperson of the Coalition for the Prevention of Unsafe Abortion, COPUA. She has received many awards, including the Human Rights Consultative Committee Recognition Award and the Lifetime Achievers Award. Emma strongly believes that social change is about empowering the grassroots, especially women, to take up new challenges as leaders in their own right. And I can certainly say from experience that Emma is a fantastic leader and movement builder. She so graciously connected us with members of COPUA when we were conducting GGR research in Malawi. Emma, my friend, it is so lovely to see you. Thank you for joining us. So, Emma, I must ask you, we often talk about the chilling effect. We were just talking about the chilling effect. And when organizations restrict work that does not need to be restricted due to a fear of being found non-compliant with the policy, can you tell us a little bit more about how the chilling effect has continued even after revocation, and what steps are necessary to ensure that the repeal is made real?
Thank you so much. It's nice to see you as well. It has been a while since there's an inquiry.
We can hear you okay.
Okay. I'm wondering. Hello?
Emma, we can hear you okay. Please go on.
Okay.
Okay.
Yeah, so I was saying that it has been a while since we last touched base. It is also exciting that finally the report is out and that you are finally launching the report. It was hard work for you, and of course on our side it was exciting that you are collecting all this information for us to start justifying some of the things that are happening on the ground. So let me join my colleagues who have spoken before me just to say, the first thing I'm going to say is that the pretense from the government of the US, where they are not coming out to explicitly talk about the removal of the gag rule versus the complete removal, because that's what we need. We do not want to be hearing the language of saying, yes, we've suspended it. We want them to say we are completely removing it, because many people, they have not even seen that communication, like my colleague from SAF8 said. You have not seen that communication, official communication, that yes, now this is the direction. It was just said the way it was said. So some people even in Malawi until today, they do not know if that gag rule was removed. Recently in Malawi, there has been a statement, what they call pastoral letter from the Catholics, that explicitly mentioned to the president that he should not listen to people who are advocating for issues to do with abortion. And this was an official letter petitioning the president, where one of the issues they raised was this issue about unsafe abortion, and then abortion. And then the addition to it is that the way things are presented, it is presented in a way that people should be made to understand that you are bringing in the foreign agenda. And you can see even in America, America does not even, accept this kind of approach countries in the West, they are not accepting this. Why should Malawi be taking this route when the countries that propagate human rights, they are the ones who are also not accepting? So for them, it is the entire America. For them, they do not even understand, or they know, or they pretend not to know that certain states in America, they accept issues to do with abortion. But for them, it's like blanketing the whole America that they do not accept abortion. Therefore, Malawi should not be a country that should also be accepting abortion when other countries are saying no. So you can see that the message that is going out there is simply saying abortion is bad and people do not, it should remain illegal. So in terms of people coming out now to exercise authority and even speak in a confident way that the GR has moved, but also as Malawi, that we can proceed with our own agenda. We are a sovereign state. Many people are not coming out to speak like that. They are actually noting the position of the churches, because they think that maybe the churches versus the West, they are talking the same language. So we have a huge problem, and for us, we have a huge problem. We have to do a road, because these things are getting worse by the day, where you are seeing strong opposition. Many people say this cannot happen. So that's the worry, that America should have come out to speak clearly about what they are doing with the GGR, if they are proceeding even to remove it, to completely remove it, that it doesn't have to come back. Maybe it can make a difference in developing countries like Malawi. So that's the position. For a civil society, some civil society, those that completely withdrew, there are some who have come back to work with us. Those who know that the GR has been removed and no one is going to trouble them anymore. Some of them, they've come back to work with us. Some of them, they are very ashamed that they did what they did back to us. It's like asking themselves twice to say, how do we interface with our colleagues whom we had thought they are not with us before? Some have totally withdrawn, they are not with us anymore. The parliament, I think you followed, the parliament in Malawi is so afraid of the religious community, because they are also looking at their votes, the 25, and talking about issues to do with abortion. They are so afraid because they do not know when the church is going to strike. At times they are even told in the face, this we are going to become. So that's the situation that we have. Though suffice to say that does not discourage us. We feel that it is an opportunity, because now we can know who is against, who is for, and that is our opportunity for us even to re-strategize and see the best way of how we can advocate for the reforms that we are advocating for. We have changed the approach now about empowering the grassroots to start demanding from their representatives, elected representatives, so that maybe if we start with just the power is coming from the, who are demanding that we need a law, we need this law, this bill to be passed in Parliament, we hope that we can succeed. But I think there's a lot that is still running. That's why we want America to come in and make it very clear about the position of the GGR. Thank you.
Emma, my friend, thank you so much. You know, you talked about the importance of organizations and individuals being able to proceed with their own agenda. And it's interesting to talk about, and Dr. Purr, you've talked about this as well, and our other speakers have highlighted it, what happens after the revocation. Some organizations were complying, some were not, and some are sort of ashamed as you come back together into those coalition spaces. Now, we just have a little bit of time, but I do want to get to some audience Q&A. Thank you to everyone on Zoom who is sharing their questions in the chat box and in the Q&A box. I can see them up here, but I also want to check in the room before I go into Zoom. We have my colleague Maddie here who has a roving mic. Is there anyone in the room with a question for our panelists? I know I put you on the spot. I'm going to go to Zoom first, but you think about it right now. So going to our friends over Zoom, I have a fantastic question. And this is for everyone, so please feel free to unmute yourself and answer. What recommendation would you give to advocates and organizations to take advantage of the revocation, but also to stay resilient until there is permanent repeal? Who would like to start? How do you stay resilient?
Is this for us?
It is. It's for you. Just jump on in, Emma.
Okay. Okay. Yeah, let.
Please go ahead.
Yeah. The mere fact that we were resilient during the time that the GDR was active, that should make you believe that we are not going to stop at anything. We are continuing. Looking at my sister Rose, I feel that we are together in this in Southern Africa. We are not renting, and then we are also getting this small support. Actually, SAFAID supporting us in Malawi with many other partners. That we should not stay quiet. We are continuing regardless, even if they are coming back to say we are not financing you. The little resources that we have will still be making a difference, because what we need, if it does not happen today, and I've said this many times, if it does not happen in my time, it will still happen in the time of the young ones, because young ones are tired. Now that we are working with the young ones who think this position of GGR and many other things that are stopping us from progressing is going to affect them more than it is affecting us today. Hence, the young ones are motivated, they are working very hard, very resilient, and talking to elected leaders and going everywhere saying we need this law. If you are not passed, it is going to be them, the young ones, who are going to pass it even if it takes 10 years, but something is going to happen. We are also very motivated that for once in Malawi, where people are not discussing this matter, now it can be discussed everywhere, in radio stations, in the media, in the print media, in the communities. People are discussing. That means that there's a revolution. People have started understanding, and that the revolution will continue. We are not relenting. The resilience is there, regardless of the finances, but we have started talking, and it will go on until we understand, until we feel Parliament does something about this. Yes, that's how I start the conversation.
Thank you, Emma. Rose or Helena or Dr. Puri, would you like to answer?
I would like just to add.
Yes, please.
That we had beautiful examples of bravery among ourselves. We had two big organizations. One is a women's rights organization, Women in Law in Southern Africa, Mozambique chapter. They did not sign. They had a big chunk of US government funding. They chose to forfeit. They did not sign. We also had IPPF intermediate partner in Mozambique, Amodefa. They did not sign. I think what I wish is that examples such as these two big organizations are copied and inspire others. We have more and more feminist organizations in Mozambique, and I believe that if today they will say we have the Mexico City policy, they will have more when more would refuse to sign. So like Emma is saying, we will keep on going, even if we don't manage to revoke completely the MCP policy. So thank you.
Thank you. Yes, please, Dr. Puri.
Yeah, my recommendations is basically like, I think we need to continue this kind of, be united and then continue this kind of, advocacy work. And we also need to, I think, broaden our network, and use all these kind of evidence we have gathered since years and use those kind of evidence for advocacy. And I think we have to be very strategic as well, because I don't have to say this audience how to be strategic. I think we have to be very strategic to move ahead, particularly for this kind of, if you want to use the certain political ideology, it's not based on the science, not based on the evidence. So this is just a political ideology, then we have to be very strategic and use our evidence. And continue to fight, and then I think we will win. So yeah, that's what I wanted to say.
Thank you.
Yeah.
Thank you so much, Dr. Puri. And unless there's anything in the room, raise your hand if you have a question. Okay, I'll talk to you after. I would like to go to one final question. I see we're at time, but I have more to say, so we're going to go over a couple of minutes. So I would like to ask one last question to all of our panelists. Same question for everyone. Rosé, I'm going to start with you, and then Dr. Puri, and then Helena, and then Emma. So for all of you, here's the question. What actions do you want to see happen next? And please feel free to consider this as what you want governments to do, or implementing partners to do, or civil society, or media, or researchers. What do you want to see happen next? Rosé, I'd like to hand it over to you.
Thank you, Bergen. The issue of opposition, some of my peers on the panel did allude to it. Opposition on SRHR and anti-gender equality has really intensified even after the lifting of the GGR during COVID-19. So religious fundamentalists have intensified it. And I'm speaking from the SADC region, my region that I understand better. And this is an area that we need to, as activists, as advocates, as SRHR allies and defenders, and gender equality and feminist advancers, we really need to understand better, come together and appreciate new and effective strategies to be able to counter opposition sustainably. Otherwise, it is slowly and subtly brewing fertile ground for the return of the GGR. And I believe that is the intent. It's become funded more, and so while pre-COVID-19, the opposition was not as intensive, it has for some reason or other really intensified. And our counteraction is to motivate SRHR feminist principles and gender norms transformation in governance, in service provision, and in autonomous agency amongst our communities, so that there is a continued priority in funding and policy decisions. The climate crisis, coupled with the pandemic, the onslaught on Ukraine by Russia, all of these are dynamics that are pushing further and further away investment, commitment, funding towards essentiality of SRHR. And opposition is fueling this. it's very important, I think, particularly from the African context, again, because I understand it best, to reinforce, and Mama Kalia said something really critical about how the fallacy that SRHR or access to safe abortion or access to contraceptive, I mean, it's always selective, right? Access to comprehensive sexuality education is from the global north, is from the west. That is a fallacy. In Africa, we have the principles of Ubuntu. And this is central to our African context for centuries. And pivotal to Ubuntu, that every African would like to hold their head up high, is the honoring of human life and well-being, irrespective of their demography, their context, and so forth. There is no room in Ubuntu for discrimination, for moralization. And so these are angles that we need to start weaving in more intensively, I'm not going to say aggressively, assertively, boldly, courageously, when we are countering opposition. Then the last one that I think is an area for advocacy that is really critical, as I mentioned, there are other dynamics that are rerouting resources away from HR, away from gender transformation. And we have very little control over them, like the pandemic, climate crisis, warfare, strife, and so forth, is the area of domestic resource mobilization. And we've heard this, we know when we want to attain universal health coverage, whether it's HIV or any other area of SRHR, domestic resource mobilization can no longer be put off. And we need to be weaving this a lot more intently within the countries in the global south, because we know that our countries are heavily reliant on aid from the global north. And this brings bondage and it paralyzes the decisions that our governments are making, the inability to make independent decisions for their citizens. We saw what the GGR did. It superseded. If the constitution, like in South Africa, for example, and Bravo, Mozambique, who also put a constitution on safe abortion later, but only if the constitution was unrestricting to safe abortion legally, then that superseded GGR, but GGR superseded. So domestic resource mobilization is absolutely essential in our advocacy work. To ensure that our governments are independent in the decisions they make to safeguard the human and social development of their citizens. And then I think one little thing, the report that's come out, that has been launched, I really hope that it will be catalyzed, repackaged in easy to grasp, simple tools, and scale up literacy and its use to motivate the spaces that I heard Dr. Puri, Helena, and Emily, Mama Emma speaking to beyond the US, so that we have a broader movement that is now able to move without fear, unlike during the GGR. So the GGR being lifted temporarily is a huge window of opportunity to expand a movement and really ensure that geopolitical decisions from across the ocean does not cause loss of life and loss of dignity for us in other areas.
Rose, thank you.
Thank you, Bergen.
Thank you so much, my friend. That was fantastic. And I know that I've taken everyone a few minutes over. I'm just going to say with 1 minute left, and I'm sorry that we just have 1 minute left. Dr. Puri, let me just hear a couple quick words about what you'd like to see happen next. And then Helena and Emma, just a couple quick words, and then we'll wrap up.
Yes, for the US government, the message is very, very simple. Because you cannot afford this policy to continue. Because this policy is not only actually damaging the global health, but is also damaging for US, because it has created negative impressions toward US. How US claim globally that this is a democratic country and then you protect the human right. How you can claim if you have such kind of policy in place, not only in your country, but also globally, then you cannot, I don't see any reasons, because I say that it's not based on the evidence. That's why you cannot afford, you have to permanently repeal. Yeah. That's a very clear message for the US government. I do have a recommendation for others as well, but because of the time, I'm going to stop here.
Well, I am going to say that we will make sure that everyone who wants to hear further recommendations, we will put you in touch with Dr. Puri, who has great recommendations. Helena, and then Emma, just briefly, final actions or recommendations.
Okay, thank you so much, Rosef and Dr. Puri said most of what I had in mind. I think one thing that I wanted to add is we didn't feel that our government was our ally during the time we were fighting this policy. So I think we should improve the way we work with the governments and make the government become our ally, because they understand that they need civil society organizations to reach the population. So why can't they help? So for me, this is one thing that I wanted to add. Yeah, thank you.
Thank you, Helena. And Emma? Oh, Emma, I believe you're on mute. Oh, Emma, I'm so sorry.
Just to emphasize,
yeah,
on the position of my colleague from staff aides to say that member states should stop talking about sovereignty. When they want to beg from the US, they don't talk sovereignty. When they want to talk about, no, we are a member state on our own, then they would be saying, no, people can die. Those that are dying are not from the West. Those that are dying, the women, are from our countries. So member states should stand tall and make sure that they save the lives of their own people and not hide in the name of sovereignty. I submit.
Emma, thank you so much. Emma, Rose, Helena, Mahesh, thank you all for joining us. For those in the room, for those of you on Zoom, thank you so much to the House of Sweden for hosting us here today. Thank you to all the researchers and advocates who participated in this interviews and created this research and are moving towards permanent repeal of this policy. I will end with a little bit. We have spent the past number of weeks speaking with the US government about this research. I know that there are many folks from the US government joining us virtually today. This is an administration that believes in science. This is an administration that believes in evidence, that promotes sexual and reproductive health, both globally and domestically. We can do this now. We can permanently repeal this policy, and we can at least make sure that people know that it is revoked. There's a lot of work to be done. I'm very excited to do it all with you all. Thank you so much, and have a wonderful day. Thank you. Thank you. Well, now for everyone in the room, let's have a little toast and something to eat. Please join us.